I'm Ryan Hayes. We're going to demonstrate the procedure for spiking and priming an IV bag and a primary and IV bag tubing. Before we do anything, we're going to make sure we wash our hands. After we wash our hands, we're going to open the bag tubing. Unkink it. Make sure we keep the caps on because they're clean. We do not want to contaminate anything. We're not going to take the caps off until we put our gloves on. So I'll put that there. But before we get started, we're going to make sure we write out our labeling. As you can see from my labeling, I put down the start date, the hour and time, discard date, and the hour and time, the discard date, and my initials. Normally it'll be for 72 hours. Next, we'll have our IV bag. And this is the stopper. So before I get that started, I'll put on my gloves. I have my gloves on. Let me get the IV bag tubing. It's in my non-dominant hand. I'll take the stopper off. I have my cap here, and before I do anything, I will lock it so I don't have any excess fluid coming out. I'll make sure it's timed and date. Wrap it around there so the labeling is on. I have my IV bag. I take the cap off. As you see, I'm twisting it. In. I'll squeeze to the filled line. Next thing we're going to do is fill the line with solution. Make sure there's no air bubbles in the line. While we're doing this, if we see any air bubbles in the line, we'll flick the line to get any air bubbles out because we don't want to have any air embolism. And of course, when I get my IV bag, I want to make sure it's the right dosage for the right patient and the right time. Of course, I would hang the bag. Before I put my cap on, I would get an alcohol pad, clean it with an alcohol pad swab, put the cap on if I'm not going to use it. Or if I am going to connect it, before I put it in the connection for the patient, I'll use an alcohol pad to clean it off for antiseptic setup. Any extra equipment I used, I would take off, throw away any gloves, clean up my area, and clean my hands. As you can see, the name tag, the tag is on there that's labeled. Thank you.